Once every 7 days, you should change the dressing around the insertion site, the location where the catheter enters the skin. Your doctor or healthcare provider will tell you if this needs to be done more or less frequently. If your dressing becomes dirty, loose, or wet, you should do a full dressing change. You should not wait until the next scheduled dressing change to do so. The insertion site may have drainage and require dressing changes as often as every 3 days. There are 4 basic steps involved in the dressing change: preparation, dressing and chlorhexidine patch removal, cleaning and scrubbing the area, and applying the new chlorhexidine patch and a clean dressing. When you begin your preparation, you should first clean your hands.
The appropriate way to wash your hands is first, we're going to go ahead and wet our hands. Apply soap to coat both hands. And you're going to scrub on all front and back of your hands, in between your fingers and at the tops of your fingernails. Then make sure you rinse thoroughly. An alternate option to using soap and water is to use an alcohol-based hand sanitizer. And you do want to make sure that the drug facts show a 60% or greater alcohol concentration.
After you have finished washing your hands, you should prepare your workstation. You can use a clean, hard work surface, or you can lay a clean towel down either on the bed or the hard work surface.
Now we're going to start by setting up our central line area to do our dressing change. We're going to first clean our surface area with an antimicrobial wipe. Discard the wipe and allow your area to dry completely. A second option that you can use to clean your area is using a clean paper towel and an alcohol-based hand sanitizer. Now that your surface area has dried, we're going to actually lay out our supplies that we'll need to do our dressing change.
These items include a chlorhexidine sponge, a chlorhexidine patch, and a clean dressing.
Also, you might find that you need some alcohol wipes available if there's any dried blood or dried drainage on the area, to first clean with the alcohol wipes and then clean with the chlorhexidine sponge.
Once your workstation is clean and ready, clean your hands again. At this point, you may choose to put on a pair of gloves and a mask, but it's not required unless instructed by your healthcare team. Now you are ready to remove the old dressing. Slowly peel the dressing away from the skin, starting at the bottom.
And when you're taking off the dressing, you can put pressure on the lines, or you'll hear them called lumens as well, to keep them in place to get the dressing off.
An alcohol wipe may be used to help loosen the dressing. If you pull the dressing off with too much force, you could accidentally move or damage the catheter or any stitches if you have them. When lines are first put into the body, you may have stitches around your insertion site. Try not to press or move this area too much. If your stitches become loose or fall out, contact your healthcare team. When your old dressing has been removed, throw it in the trash. If the chlorhexidine patch did not come off with the dressing, gently remove it and throw it away. At this point, if you're wearing gloves, you should remove them and throw them away with the dirty dressing. Repeat the hand hygiene procedure whether or not you are wearing gloves. Now that the dressing has been removed, look for signs of infection. If you notice increased redness, pain, warmth, or drainage, call your healthcare team. Look for drainage that is green or yellow in color, and if it has a foul odor. Before you begin scrubbing the area, open the chlorhexidine sponge and release the liquid by squeezing the wings until you break the seal.
By pressing these wings together, you'll hear a loud click. You'll turn the sponge over and see that the chlorhexidine solution is flowing down.
The sponge handle contains chlorhexidine, which is a solution used to clean your skin. Gently scrub the entire area around your insertion site with the chlorhexidine sponge. Use overlapping strokes to ensure you cover the entire area.
You want to make sure and scrub well at the insertion site, and also you can lift up underneath the line.
You want to scrub the site for 30 seconds and allow to air dry for 30 seconds before you continue. Do not blow on or fan the area, as this may contaminate your insertion site. Now you are ready to apply the new chlorhexidine patch. The patch contains chlorhexidine and will help fight off infection for several days. The chlorhexidine patch has a blue side and a white side. The blue side should face up towards the sky, and the white side should be placed against the patient's skin. Make sure the slit fits around the catheter at the insertion site. Place the chlorhexidine patch so that the slit faces towards the line. Lastly, apply the new clean dressing. Aim to have the chlorhexidine patch and the insertion site in the center of your dressing.
So you'll just press it firm on the skin. You don't have to press hard. And you'll then press all around it, making sure all of the air bubbles are out, that type of thing. So I'm just sealing it all around, and then the white part will actually peel off. So you're going to peel like so.
Once you have finished, you can remove your gloves and place all of your used materials into the trash. Look at the site daily for any drainage or a dressing that is loose or dirty. If your dressing is loose or dirty, you should do a complete dressing change at that time. Some common questions that patients have include: what if I have redness, drainage, pain, or irritated skin at my central line site? If your skin becomes irritated, your nurse can recommend a skin protectant to use when changing the dressing. If you notice increased pain, warmth, or drainage, call your healthcare team. What if I drop my dressing or other supplies? If you drop your dressing or other supplies, throw away the item you dropped and use a new item. What if my dressing becomes loose or dirty before the date it is due to be changed? If your dressing becomes loose or dirty, it should be changed, even if it is before the due date. What if I notice my stitches are loose? If you notice your stitches are loose, call your healthcare team. For any other questions or problems, contact your healthcare team.